Okay, hello. Welcome to our webinar on good nutrition and hydration in the recovery of COVID-19. We're really pleased that everybody's joined us today. I can see here that we've got almost 100 people logged in, and it seems to be clocking up as we speak. So yeah, really pleased to have everybody with us. So my name is Emma. I'm the Programme Director for the Greater Manchester Nutrition and Hydration Programme. I'm going to go around, my colleagues go around the table today to ask them to introduce themselves. So we'll start with this on my left, which is Councillor Chauhan. Could you introduce
Hi, I'm Zahid Chauhan. I'm GP and also Councillor and Cabinet Member for Health and Social Care, Oldham Council.
Brilliant. And Kirstine?
Hello everyone, I'm Kirstine. I'm Consultant Dietitian from Salford Royal.
That's great, thank you. And Councillor Harrison?
Hello, I'm Jenny Harrison, Councillor for Alexandra Ward in Oldham. I'm currently Deputy Mayor also, but formerly Chair of Health and Wellbeing Board and a Cabinet Member for Social Care.
Brilliant, thank you. And Jean?
Hello, I'm Jean Rollinson. I'm the Director for Ageing Well at Age UK Salford.
That's great. And Carmel?
Hi, I'm Carmel and I'm the Nutrition and Hydration Programme Manager for Bury and Salford.
That's great, thank you very much. So now we'd like to take a minute to get to know the other people in this virtual room. So we've set up a poll that we're going to ask you to participate in. So Carmel, could you launch the poll for us now, please? Okay, so there are 3 questions here. The first one is, where are you from? And then you need to scroll down. The second question is, what sector are you from? And the third question, are you actively involved in the Greater Manchester Nutrition and Hydration Programme? So if you could answer those 3 questions now. Okay. Carmel, can you see we've had a lot of people watching that?
Yeah, so we've got 89, 90, 92, 93, 94. So we'll give it a couple of more seconds.
Okay, brilliant. Okay, we'll close the voting now. So Carmel, you could share the results, please. Okay, so we can see here we've got 76% of people in the poll are from Greater Manchester, 19% from North West England. We've got a few from the southwest and southeast of England, and 3% from Scotland. We've got 1 member of the public. Some people, 16% of people who are carers. 34% who work in health, family care, a range of people from secondary care, voluntary sector, adult social care, housing, council and the CCG. And we've got about 35% of people are involved in the programme, 65% of people are not actively involved in the programme. That's great. Okay, thank you very much for taking part in that. That's really helpful for us to get a sense of who is in the room with us today. Can I just ask my panellists if you could mute your microphone if you're not speaking?
Sorry, could we what?
Could you mute your microphone if you're not speaking, and then because I think there's some playback through. That's great. Okay, so the format of the webinar today, we're going to start off with a presentation, which will be between myself and Carmel. We'll talk about some of the key information which has informed the Greater Manchester Nutrition and Hydration Programme and which is relevant to us at this time in recovery from COVID-19. So we'll start with the presentation, which will take about 20 minutes. There'll be some polls throughout the presentation, so you'll have an opportunity to get involved and share some feedback. And then we're going to go to each of our panellists who will share some reflections and give us some insight about how this is relevant to the work that they are involved with at the moment. And then at the end of the session, we'll have about 15 minutes for a question and answer. So I'd like to invite you to pose questions to the panellists throughout the session. You can either do that, ideally, by clicking on the Q&A button at the bottom of your screen. If you click on that, then yeah, please make your questions visible to all panellists and attendees so that other people can see the questions that are being asked. If you can't do that, then there's also the chat option. So yeah, you can put questions in the chat. I'll be monitoring that, and then we'll put that to our panel. If you'd like to pose a question to a certain person on the panel, that's great. You can just put their name in the introduction. If you want to put it generally to the panel, that's also fine. You can just put a general question out there. Okay, so without further ado, we're going to make a start with the presentation. Okay, if you're new to Zoom, then you can see on the right-hand side, you should be able to see the videos of the people involved, and you can change that if you just want to see the person who's speaking, or if you want to see everybody who's speaking. You can move that around your screen as well if it's in the way of the slides. So I wanted to start off by just thinking about the environment that we're currently all working in. It's been a very uncertain time. We have experienced a pandemic that many of us will never have experienced this kind of situation before. And we're now starting to think about what this will mean for us as we start to come out of the initial phase of COVID-19. Now, this analysis here gives us some insight into the different ways in which people may have been affected by COVID-19 and may continue to be affected by this for quite some time. So I'll just go through some of this in some detail. So the first wave we're expecting to see, well, we have already seen, unfortunately, people who have been directly affected by the virus. They may have caught the virus and some may have sadly died from the virus, or they may have be recovering, having been in hospital for quite some time, some of them on intensive care and ventilators. We've also got a group of people in the second and third waves who their routine, either their urgent healthcare needs or their ongoing care for their chronic conditions may have been affected by interruption to normal healthcare services that we would expect. And then finally, there's a fourth wave of people, and that's the one with the red line at the top, where we're expecting to see quite a large number of people, most of us living in society, who will be affected for quite some time because of the wider impact of COVID-19. Now, for older people, we can start to think about what that might mean. Some of the factors due to the social distancing measures that have been in place, and some of the lack of social contact people might have faced, but also the lack of access to the type of food and social support that people may usually expect. And we can start to predict that might cause for some people an acceleration of the ageing process. Now, this will affect everybody differently, but we can start to think about how some people who may have been coping very well or living very well and independently may see an acceleration of that ageing process, which could lead to a very different lifestyle and different outcomes for them, and potentially greater dependence on others for their health and well-being needs. And the second thing I wanted to share is this quote from the World Health Organization. So I'll just read this out for us, because I think this just sets the context for the discussion that we'll be having today. So support for older people and their families and their caregivers is an essential part of the country's comprehensive response to the pandemic. During times of isolation and quarantine, older people need safe access to nutritious food, basic supplies, money, medicine to support their physical health and social care. Dissemination of accurate information is critical to ensuring that older people have clear messages and resources on how to stay physically and mentally healthy during the pandemic and what they should do if they should fall ill. Now, this quote from the World Health Organization, I think, really highlights to us that importance of the dissemination of accurate information. So that's one of the things that we'll be going through in the presentation today, so that we can all be clear on what we mean by accurate information, particularly in relation to nutrition and hydration for older adults. So I'm now going to hand over to Carmel, who will take us through the rest of the presentation.
Hi, good afternoon. Thank you, Emma, and welcome from me as well. I would like to start by sharing our vision with you, which is to ensure dignity and health and well-being of older people are met by understanding and promoting their nutrition and hydration needs. We do this by educating, by raising awareness and engaging with services and organisations who in their daily tasks come in contact with older people. And why should we focus on malnutrition? Well, it's a hidden problem. It's estimated that 1 in 10 in the UK is either malnourished or at risk of malnutrition. It's all around us. A third of recent hospital admissions and care home admissions are already malnourished or at risk of malnutrition. The consequences are huge. They're huge on a personal level and they're huge on a national level, economically and socially. For every 10 days, a person over the age of 80 who spends a day in hospital, they lose around 10% of their muscle mass. And this in turn is likely to lead to other health complications, to falls, to reliance on health and social care services, and a lowered overall independence and quality of life. It's expensive. Malnutrition costs to the health and social care system a staggering £20 billion every year. It affects vulnerable people the most. The older the person, the more likely they are to be at risk. And it's totally preventable in many cases. It's important to remember that losing weight is not a normal part of getting older. This is a common myth. Since March this year, we've been faced with a new, quite frightening reality of living through a global pandemic. This has affected us all, but even more so, it's affected our older population. Many elements of their lives, which beforehand were beneficial for their independence, such as socialising, getting outside, attending community clubs, all this had to stop. And it had to stop for a long period of time, and some are still not getting out. But because of this, many of the risk factors have increased for older people. Risk factors such as loneliness, mental health issues, and physical issues as well. And also people who have been in hospital with COVID-19 are experiencing high levels of weight loss due to a combination of factors such as being on a ventilator, taste and smell changes, and increased nutritional needs. So I mentioned a couple of slides back that in many cases malnutrition is preventable, which is really the good news here. And there are three main ways of preventing this from happening. You can give simple advice. You can encourage the person to eat more or change their eating pattern. Encourage them to add extra calories to their foods. You can use gentle encouragement. You can ask them what you're having for tea tonight. If they don't know by late afternoon what they're planning for tea tonight, the chances are they're not having anything. You can offer them social support and lots of prompting. Ask them the questions. Are there people in their lives that can maybe help them with this social support? Can they eat with somebody? So we know that the COVID restrictions have been strict, and some have been forced to be on their own, but some of these are opening now, and which can allow this to happen. So they should be using that now, and they should be encouraged to be using that. A research that we recently completed with Manchester University showed that simple advice, encouragement and prompting can have a really, really big difference on older people who are at risk of malnutrition. We're going to talk more about that evaluation in the later slides. So here are your really simple conversations. What are the things that we can ask people to find out more? Key questions such as, have you lost weight without meaning to? Have you had a poor appetite, low energy or low mood? Do your clothes, shoes, jewellery or dentures look or feel loose? Do you think you might be underweight? If they answer yes to any of those questions, or you have answered yes to any of these questions because you know the person, key messages from our Eat, Drink and Live Well booklet should really be highlighted at this stage. We're going to talk about that booklet in the later slides as well. And here is a really visual way of looking at the situation as well. So when you talk to a person or when you look at a person, try and kind of paint this image in your head. Aim to ask questions that can answer the following things on this image, and look at the person and see if that can answer your questions. You know, do their dentures look loose? Do they feel loose to them? Do they have thin arms and thin legs? Are their clothes and collars, are they baggy? Do they look loose? Are their shoes loose? Do they say things to you like, oh, I've lost weight without meaning to. I've got a really poor appetite. It's not what it used to be. I find it really hard to keep warm. I don't see the point of cooking for just one person, or I don't see the point of eating, or I feel tired all the time. I can't access the shops. These type of things would paint a really, really strong picture that that person is not eating and drinking as well as they should be. Here we have the PaperWeight Armband. So this is a really, really simple tool. It can be used by anyone and everyone. You do not have to be a health professional to be able to use this. It's simply PaperWeight Armband, as it says, and it's 23.5 centimeters in length, and it wraps around someone's middle upper arm right here, and it can instantly tell you if that person has a BMI of less than 20. So BMI is our body mass index, and it's the proportion of your height to your weight. So if your BMI is low, it means that your weight is not high enough for your height, and that ultimately puts the person more of a risk of developing malnutrition. So I said that I would talk more about the University of Manchester evaluation. So Emma, if you can just go to the previous slide. So what we found that we use this tool together with our brief intervention, which is that booklet that I'd mentioned on the previous slide. And we found that 81% of all our participants managed to have a positive outcome at the end of the 12 weeks. So we saw them at first and their paperweight armband fit on their arm, and we therefore gave them information that we wanted them to take on board. And when we visited them after 12 weeks, 81% of them either maintained their weight, but many of them actually put weight on, which is quite a big success rate for an evaluation like that. So simple tips and advice. We really always encourage the food first approach, because food is so much more than just fuel. In many cases, it's linked to enjoyment, it's linked to socialization, and it's linked to routine, which is really, really important for older people, well, for any age group people. Social support, always remember to offer this if it's possible at the time. Eating in company and talking about diet can really help to boost appetite and keep interest in food and drink. Consider the access that the person has to food and food preparation. Some will need more help and more support than others. And consider mental health. So poor nutrition and hydration can be both a cause and a consequence of poor mental health. And the improvement of one can therefore have a positive impact on the other. So I'm going to take you through really briefly the main tips from our Eat, Drink and Live Well booklet. So what we always suggest is eat little and often. So it could be that the person that you are talking to is, you know, overphased by large meals. So maybe encouraging to have 6 small meals a day rather than 3 large meals a day, it feels more manageable to them. Adding to their food or to your food to increase energy without increasing the portion size. This is what we call food fortification. So this is adding things like cheese or cream to foods that we would use and eat on a daily basis. Using milk powder. So milk powder is basically just dehydrated milk, and the powder that's left on the top is protein. So adding that to, for example, anything that they have with milk. So if you mix it with milk and then use that milk for their food or for your food, then that doubles the protein content of that food. So it can be used in sauces, in soups, it can be used in cereals, in porridge, mashed potato, anything that they would be having milk with. Having more protein, so adding extra pieces of meat or tinned lentils into soups, casseroles, stews or pies, and protein is really, really important in building back muscle mass. Eating with others when it's safe and possible. Some people eat better when they share lunch with someone else. We've even heard of people sharing lunch over video or during a call, so that's also really beneficial for them. And making sure that their meal preparation is easy. If it means that they have to get or buy, you know, Meals on Wheels or ready meals, it doesn't matter as long as they are eating. Okay, and moving on to hydration. So older people are more vulnerable to dehydration, and that's due to physiological changes in the aging process. This can be even further complicated by many disease states and mental and physical frailty that can further increase the risk of dehydration. Such age-related changes include reduced sensation of thirst, and this can be more prominent in those who have got dementia or those who have suffered a stroke. So to stay really well hydrated, we need 6 to 8 cups or glasses of fluid a day. And this includes any fluids. Many of us, we know, don't drink enough, and particularly as we get older. And because of this reduced sensation of thirst in older people, it might not be, we might not be able to rely on the person telling us that they're thirsty. So these drinks should be incorporated throughout the day very regularly. It's always safe and healthy to encourage everyone to drink more and stay well hydrated. And here's some signs that you can look out for. So you can look at the colour of the urine. This is not, however, always an accurate indicator for older people, but it's still safe to assume dehydration and encourage more fluid intake, especially if the colours are around the mark of 7 and an 8. And you can always try the pinch test. So this is when you pinch the back of your arm like this, and I'm gonna get you all to try it now. So have a little go, and I'm gonna pull a poll up, and when you've had a go, you can answer it. Okay, we've got answers coming in. I'm going to give you a couple of more seconds to vote. And it seems like we either have very well hydrated people in the audience, or your skin is wonderfully elasticated. In my case, it was both, I think. Okay, brilliant. So 80% of you, well, 79% of you said that you are well hydrated. Okay, so those who answered that they say that it shows that they're dehydrated, then I suggest you have a glass of water or anything. Okay. Okay, some final messages for you. The real beauty of this program that we've been running in the last 2.5 years is that anyone can share the messages and anyone can intervene. You do not need to be an expert to be able to do that. Often it's just about encouraging people to make small changes that will make a really big difference. Many people may not even realize that they were ever at risk, or that they are underweight, or that they could do something about it. So just opening their mind up to that can make a really big difference. However, if you are worried, you should always encourage them to see their GP or contact their local community dietitian. This, you can, if you are worried, you might want to look at the red flag questions that we are going to show you in the next slide. So there comes a time where, you know, simple advice is not enough to give to somebody, and therefore we've developed these red flag questions. So if you have noticed, or they have noticed, a really sudden weight loss of 10% of body weight in 3 months, then that is a reason for concern and should be referred to a GP, as well as, do they have difficulty swallowing food or drinks? Do they get pain in their stomach when they eat? Or have they had a recent persistent change in bowel movements to either looser stools or increased frequency? So if the answer yes to any of these questions, that might indicate something more sinister. So they should be they should be referred to a healthcare professional or a GP. Anyone, though, who at a risk of malnutrition should also be encouraged to see their dentist, particularly if they have a sore mouth. And I am going to give you a scenario. So your next door neighbour is an 88-year-old man who lives alone. You have a good relationship and you have been supporting him with shopping during this pandemic. Recently, though, you've noticed that he looks like he has lost weight. His clothes are looking baggy. You ask him what he's having for tea, and he tells you that probably nothing because he can't be bothered to cook. You ask how his appetite is, and he tells you it isn't what it used to be. He says he's eating less than normal, but that has to be expected because he's not as active as he once was. What would you do? So I'm going to, again, open a poll and have a think of this scenario, and have a think of you have somebody like that in your life, or that you know somebody, and answer the question as to the most appropriate answer that you would have. Okay, I'm going to give you a few more seconds just to give everyone a chance to vote. Okay. Right, I'm going to share the results with you, which have really made me smile, because I wanted to say that the only wrong answer in here is nothing, and I'm glad that nobody said that. It doesn't matter what you do, as long as you do something, even if you just have a prompting chat with them, ask them to speak to their GP, do something, because that can really, really stop that person from getting into that vicious cycle of malnutrition. Okay, and this is probably the most important slide of today. What can you do? What can I do? For everyone, you can raise awareness with friends, you can raise awareness with family, neighbours, colleagues. You can ask older people the key questions that we've been through and share simple advice if needed. You can circulate a training video that we have, and we are going to send this to you for anyone who's registered for this webinar. We can send you the video, and it can also be accessed on our YouTube Age UK Salford site. You can support us on social media, so you can support us on Twitter, on Facebook. And if you're a strategic leader or a service manager and you don't already engage with us, you can incorporate key nutrition and hydration questions and gentle prompting and guidance to all your existing interactions with older people. So, for example, welfare calls, through care and support, through care plans. And we're asking you to really put older people's nutrition and hydration really strongly on your agenda and consider it in all your strategic plans and all your recovery plannings. And you can see here our available resources. So as I mentioned, our main booklet, which is the Eat, Drink and Live Well. You can get this either from our website, or if you are in Greater Manchester or the organisation that you work for is in Greater Manchester, you can get this free from us. We also have other booklets such as staple cupboard recipes. So these are really simple recipes using mainly tinned and frozen foods. And then the Food First recipe booklet, which goes really hand in hand with the Eat, Drink and Live Well booklet. And there you can find recipe ideas for really high energy meals and snacks. So this is really for those, you know, people that we've spoken about through this presentation who need to be putting more weight on. We also have meal and snack ideas from a range of different cultures. And we have an Eating and Drinking Well with Dementia booklet that you can access. It's a guide for family, carers and friends, and it's got really simple tips on what to do if somebody in your life is affected by dementia. And we also have a Vegetarian for Life resources. It's got recipe ideas and information for people who are older and are vegetarians and vegans. And if you want to learn more, we also have a e-learning tool for malnutrition and swallowing difficulties that can be accessed in the link below.
Okay, thank you very much, Carmel. So that hopefully everybody's learned something there. I can see there are lots of comments in the chat, and we've got some questions that have come in the Q&A. So yeah, I'll be doing a job of going through those and getting ready to pose those to our panels in a few minutes' time. So before we do that, we've got about, we want to keep about 15 minutes for the question and answer. So I'll ask our panellists to each give us a couple of minutes reflections about what you've heard today and how this links with the wider planning that's happening within your work at the moment. So I'm going to start off by asking Kirstine, who's with us today, to give us her reflections. Over to you, Kirstine.
Thanks very much, Emma. First of all, I'd just like to take the opportunity, because I know 76% of you are from Greater Manchester, to thank you sincerely for all the amazing work that's happened across Greater Manchester on the back of the Nutrition and Hydration programme. We are immensely proud of everything that everyone has achieved, and it is heartwarming as the inventor of the PaperWeight Armband to see this being such a success, and certainly we wouldn't be here without you all participating today. And a big shout out to Age UK Salford and Dave Haynes. I'm sure we didn't think we would get this far when we sat down and co-designed PaperWeight Armband and our resources for Salford 5 years ago. As Emma said, I'm consultant dietitian. I work at Salford Royal, and so I've been chairing the clinical reference group for our programme over the last couple of years, and we have representatives from primary care, academia, care homes background, Age UK Salford and public health team. So we are really keen that you use the resources. And COVID-19 for us really has very much brought the issues of nutritional health sharply into focus. And we know that there's an increased risk of malnutrition across very vulnerable groups such as older adults and also BAME population groups due to some of the health inequalities that we face across our localities. And we have exceeded expectations in that the intervention of PaperWeight Armband and the resources that we have alongside this have the desired impact of an 81% improvement or maintaining people's nutritional health just by some very simple interventions and food fortification or changing and having a conversation about what does good nutrition look like for you within your communities. We do know that we've hit the perfect storm with COVID. It's been very challenging as professional lead for a dietetic team in Salford. We perhaps haven't been able to go into our care homes or go and do as many domiciliary visits and see people in clinics as we've been accustomed to. And we feel as a dietetic profession across Greater Manchester, because we've had those resources to hand that we've worked on for the last couple of years, that we have been able to galvanise and mobilise very quickly for a Greater Manchester response to this epidemic. And we hope that we can still build on that. I know there's 35% of people on the call today who've been involved, but it's how we move that to the other 65% to get you actively involved in the programme and come along and work with us. And as Carmel and Emma have alluded to, really what we're looking for is the need to keep this momentum going. Our call to action is very much about how we embed this into business as usual, be it all in a brave new world of COVID, but we would implore you to take the opportunity to think about how you embed this into your current services, your pathways, your health and wellbeing boards and primary care. And really we want to be able to commission for good nutrition and hydration across the whole of Greater Manchester. So that's my reflections, Emma.
Brilliant. Thank you very, very much, Kirstine. And before we move on, I'm just going to encourage people. There are a few questions coming in, which we will address all of the questions that are coming in. A lot of them are about where we can get the booklets and the paperweight armbands, so that's brilliant. So I just encourage you, please do think about questions you'd like to pose to the panel. Okay, thank you, Kirstine. And now I'd like to pass on to Councillor Dr. Chauhan.
Thank you very much, Emma, and thank you to all the colleagues. I'm not going to take too much of time. I think my reflection is more coming from the community point of view rather than as medic. I see patients all day long. Well, I was used to. I don't see them as much now. But always seen, you will see parents, grandparents coming to GP surgery and saying, I'm really worried about this baby, this child. And main reason will be, this child is not drinking and is not feeding, yeah? And they will tell you all the signs that these nappies are dry, etc., etc. And to be fair, they know as much as probably medics will know. And I've just sat here thinking, what happened in our society where our priorities changed so much? While we care so much about our children, why don't we care about our senior citizens? Those senior citizens either are in isolation and loneliness by themselves at home, but they still have contact with someone. Most of the time, you will have someone coming, approaching them, speaking to them. So as a society, where we went wrong, where we stopped caring all of a sudden for a certain segment of our society, which is our senior citizens. How comes that we care rightly so much about children, but we don't care that much about our senior citizens? And it's amazing work you guys and your team have done. And I think one of the key achievement is actually having these conversations where as a society, we start having those conversations and saying, it's not only about managing when you start losing weight, but what do we do before we get to that stage where people start losing weight? Why do we wait when we get to 10 kg or 10% of your body weight? Why we can't pick it up when someone starts missing their meals for within first 2 days, within first 3 days? And it absolutely, Carmel is right, it makes financial sense, it makes economical sense, and I will be surprised if anyone even argues that there's no point. And most importantly, it makes moral and ethical sense of saying, we look after our elders as they did when we needed, when we were kids or children. And I've seen from medical point of view, and no disrespect to any of my colleagues who are audience or participants, but I've seen myself visiting homes, care homes, patients' own home, and you think, I need to send you into hospital to get IV fluids. You could drink, or I could have supported you to drink and take sips. I could have avoided all this, and I don't know what's going to happen with you in hospital. I'm putting you more at risk from infections and interventions and this. So why, I think personally myself, how did I fail to my neighbor who lives next door to me and has been starving, maybe because of loneliness, maybe because of his mental health problems, maybe because of the financial reasons, maybe because of some other reasons? Why did I fail on my neighbor? And when as a society we will start coming together and start looking after our most vulnerable in our society at the lowest point of their need. And it can happen to anyone. I know we discussing senior citizens. I do quite a lot of work with homeless people. I see them, they are not senior citizens. I see them how they struggle. And it's my personal belief that if our senior citizens had good nutrition, They were not immunocompromised because of malnutrition. And if they had a good hydration, not over the last 3 months, but retrospectively over the last few years, we could have avoided loads of chronic diseases. And we know those chronic diseases, frailty, led to a lot of deaths during the COVID. So one of the lessons for us should be during this COVID is, how do we prevent future COVID? I was talking to my 13-year-old son, and I was sharing this story with Jenny yesterday. And he said, Dad, you know, when my grandkids will read history in school, you know what they will read? They will read about COVID pandemic in 2020. And I thought he's absolutely right. But I think maybe historian will also write, what did we learn from that and where we went wrong? So I'll leave you with that thought. How comes as a society we became so careless towards one part of our society? Thank you.
Thank you very much. Really useful. Okay, I'd like to go to Councillor Harrison next, please.
I'm on. Yep. Well, thanks for inviting me. It's been a really interesting time up to now. I was first introduced to the pilot in 2018 by Marie Price, who's Age UK's manager for the project here in Oldham, one of the target boroughs, and Julie Holt, one of our public health consultants here in Oldham. And they asked to meet with me because I'd just become the chair of the Health and Wellbeing Board in Oldham. And the information that they were sharing with me, much of what Carmel's touched on this afternoon, the statistics about the numbers of people who in the older age group were at risk of malnutrition and dehydration. I found it quite staggering, to be honest. And it ties in a way with what Zahid was just saying, that perhaps, you know, we haven't been as aware. And this pilot project has certainly brought these things to us and made us really, really think about it. And also, I was struck by how simple things it can be to redress these problems and tackle these issues through, you know, simple fortification of meals, recognition perhaps of a problem through the very simple but ingenious armband that can indicate whether people are unintentionally losing weight or not. So after meeting with Marie and Julie, I really was convinced that we needed to get that message out there to people who were in a position to do something about it, sort of movers and shakers in the health economy and the care economy. And in my position as Chair of Health and Wellbeing Board, I was in a position to get it onto the agenda. And quite early on, Marie came along and did a presentation to Health and Wellbeing Board. And the reaction was very good. It was what we were hoping for at the time. There was good uptake. But I was also able to suggest ways of getting the message out through other means that we have within our councils, through district executives, councillors, officers, our MyoCare, which is our social care community interest company in Oldham, community groups, community cafes, through community newsletters and so forth. So it just set so many thoughts going in my head, and I was able to sort of pass on ideas. And in 2018, in October, I attended the conference at Salford Royal Infirmary, which was to let us see what was happening across Greater Manchester with the different projects, the different things that were happening. And I was really impressed by the impact that a lot of these projects were having on the improving health of older people, to improving their nutrition and hydration. And I attended the one in Berke again the following year, which showed how the work had been built upon, and I could just see just by raising awareness, by creating the projects, creating the links, creating the networks, people were becoming more and more aware, and more older people were being helped through these projects. I also attended, Marie and others organised a global tea party in one of the spaces in the library in Oldham. The first one was really, really well attended, and again it was another means of getting the message across about what the problems can be, but how they can be quite simply and easily addressed. But also it was that thing about enjoying eating delicious food together, enjoying things in a social setting. And that's another thing that we really need to look at and to continue to look at, the need for everybody, older people in this instance, but everybody, it is an enjoyable thing to eat in company, and so many older people who are isolated don't. So we do need to continue to look at how we tackle that as well. We have had a lot of community cafes starting in Oldham, lunch clubs and so forth, and we as councillors are often in a position to support these things, to make sure that they've got a wider outreach to people. And we've seen some lovely success stories with that, with people being brought together who would normally have been eating on their own, or perhaps not eating at all. So there are so many things that we can do, but you know, getting people to know first of all what the issues are, and these projects have been fantastic in doing that, and then building on what we can do about it. As many places, Oldham has an ageing population, and we talk about this a lot, but the questions are, what are we doing about it? What are we doing to help people to have fewer hospital admissions as they get older? Because poor nutrition is such a big factor in why so many people end up in hospital. We've heard about how detrimental that can be, helping people to maintain independence, to develop groups. I'm just hoping I've not missed anything out that I was going to say, but just encouraging them to have, you know, better health, and especially at this time of COVID, our resistance and recovery and whatever else can be so much dependent on good nutrition and so forth. We set up hubs in Oldham which have helped thousands of people who are vulnerable, who can't get out, and especially older people. They've been helped to get food into their homes, but obviously that doesn't help with the socialising, apart from just a knock on the door perhaps once a week. So as we hopefully come out of COVID, we don't know how long that's going to be before we can start to get together. And I know Marie Price has kept things going. She's been distributing packs online that people can download, people in different care settings, social settings. So it's been brilliant that the work of the Nutrition and Hydration Project has still carried on through the pandemic period, and I know will continue. And we have in Oldham our deputy leader. She's been given the portfolio for planning for going forward as we do come out of the pandemic, and we've got to make sure that these things are high on the agenda. As Zahid said, making sure that I'm very much in this age group myself, I might add, very firmly in the 65 plus and more. So you know, it is so important that we keep this very high on the agenda. Thank you.
Thank you very much. Great. So finally, we'll go over to Dean Rollinson, who is the Director of the Age Well Strategy at AGK Salford.
Hello everyone. I think Emma put me on last so that she can mute me and cut me off when we run out of time without me taking offence. So I'll try and run through what I was hoping to share with you, which was some of the reflections from Age UK Salford and what we've been dealing with during this pandemic. I think, like most of you, I think lots of the traditional services that we were used to running, you know, we had to stop our dementia support services where we run buddy cafes for people to get together. We ran services for people at our day centre, which we had to close along with the community cafe. And as well as being a loss for those social reasons, it was also where people mixed, got information and were able to eat socially. And it was also a bit of a loss because it's where we used to pick up the visual signals if people weren't eating well. And we were very well equipped because we've been with this programme for a while, so we knew how to intervene when we were physically with people. But when, thanks to COVID, that all disappeared, we had to think a bit differently. And so what I was really going to say was just spend a few minutes in telling you a little bit about what we did, not because they were particularly innovative, because I'm sure lots of you also responded really well with marvellous projects in order to help people during this period. But really, it was how we continued to do what we did and still managed to get messages about eating well and drinking well and tackling some of the reasons behind that out as well. I think the first thing that we realised was a problem straight away was the basic needs to get hold of food. We had that awful situation when it was suddenly announced that people over 70 shouldn't go out, and the supermarkets became a bit of a battleground with panic buying and all the online slots for deliveries disappearing. So we quite quickly, quite amazingly for us, because we've never considered ourselves particularly dynamic, but I think this was one of our finest hours. We very suddenly turned the delivery of food to our day centre services, which had closed, into an online shop. So we actually set up our day centre as a store and very quickly set up a shopping system for people to be able to order essential foods from us and for us to deliver that within 24 and 48 hours. But in how that worked, in making those phone calls to find out what people wanted to order for us, actually that was a really natural way to have a good discussion about what foods people were ordering and what they were going to cook with it, and what you're having for your tea tonight, you know, a la royal family was a general topic of conversation. And we did, through those as well, start to pick up some health concerns. Some people were eating less, some were eating more, but there was a general loss of interest sometimes in life and a loss of interest in appetite specifically, and people were less active as well. And we also noticed through those orders that sometimes they started to get worryingly smaller, and we did wonder what people were putting together as a meal at some point, and that prompted some other conversations. So as well as that practical side, we then tried to give people tips to how to put meals together. So the staff from our community centres who used to cook meals for real people became video stars and suddenly started cooking meals on video, which was interesting because we were then able to follow that up with recipes online and add to that the tips for how you could make them less calories if you were losing weight and more if we needed to gain weight. But what we also was a spin-off was actually people liked looking into people that they knew and they'd missed doing things. Even though there's this huge amount of information and YouTube videos out there, actually local still seems to really matter, and perhaps it matters more now than it did before. I think it's also very key because it's important, as Carmel said earlier, about where people get information from that they trust. What we found through those personal one-to-one conversations, through the videos, and then also through the Zoom sessions that we set up from a number of sources. We're a part of the Age Friendly Salford programme, and we run a series of brew and chat sessions through that, and our own dementia support services were already running Zoom sessions, and they're a great way again to have that cup of coffee and a chat, or a bit of a meal and a snack, but obviously you have to provide your own, but never mind, we can still do the chat and share that. And eating and what people have been doing was just a natural avenue and conversation for us to get lots of these messages out. So I think that's really all I was going to say. I think when I thought about it, our response to COVID has been to do things personally in one-to-one where we could, where we had staff available to do that and have those conversations, in a social way through those group chats, in a sort of online but still neighbourly way, using people that they knew through the through the websites and Zoom, and also very practically through to the provision of food. And as one person said, Emma asked me if I would find a case study, but actually I think the case study is probably summed up by a comment that we got who said, "Thank goodness you were there, because we'd have starved if it wasn't for you." So I think that sort of sums up nutrition and hydration. If you haven't got access to the basics, you know, people are going to struggle. So we've learned quite a lot. I said at the start we weren't doing anything that remarkable, but having said that, it still made a difference, and it hasn't been as difficult as we thought. Thank you.
That's brilliant. Thank you very much. Thank you so much to all of our panellists. It's 3 o'clock. I don't know how the time's flown so quickly. So I'm just going to ask our panellists if there's anybody that needs to leave immediately, please feel free to log off now. So do you want to just indicate if you need to go off? I know that you've all got busy schedules, and if so, thank you so much for joining us today. If not, we will keep going until about 3:15, so that we can respond to some of the questions that have been raised. So if there is anybody that needs to leave, please go ahead, and thank you so much for your time. Okay, so we'll continue now, and if any of our panellists have to leave, that's obviously fine. So the questions that have been coming in, I think firstly to say thank you so much to all the participants, everybody that's joined. Thank you in particular to everybody that's joined from care settings. I can see that from the comments that there are some people who have joined from care homes and from home care settings. And, you know, we really want to recognise the amazing work that is happening in very, very challenging circumstances in care settings across the whole of Greater Manchester. We know that everybody's faced challenging times at the moment, but yeah, really recognise the contribution from all the carers and everybody who's been supporting older people at this time. So I'm going to go on then to have a look at some of the questions that have come in. A few of them have been about the resources. So where can we get the PaperWeight armbands? Where can we get the booklets? How can we access the e-learning tool? And can we have a copy of the slides? So yeah, thank you so much for all those questions. We will send out links to all of these resources after the event today. If you're in Greater Manchester, we can provide printed copies of all of these resources for you. And if you're not in Greater Manchester, then get in touch with us, and the PaperWeight armbands are available for sale. And some people have asked whether they'll still be available, you know, how long these will continue to be available for in Greater Manchester. So that depends slightly on future funding of this programme in Greater Manchester, but certainly for the time being, they are available widely in Greater Manchester. So aside from that, there was, I'm going to go through some of the questions and comments that have come in. So Sharon from AGK Blackburn with Darwin has let us know that she's received free drinking aids to distribute to older people from the Dehydration Foundation, particularly for people with dementia, to prompt drinking. So she said she can share details with us about that. So yeah, Sharon, please do share the details of that, and we can circulate it with the other resources at the end of this event. Tracy Annette has posted a few questions, so I'll try and group those. So having recently attended a fascinating training session on the importance of oral hygiene, I was amazed to learn of the connection between pneumonia and other chest infections with mouth bacteria connected to poor dental and gum care. Yeah, that's a really important point, and I think it's really important for us to be aware of the importance of good oral health. Sorry, I'm just scrolling through. So we have Nutrition and Hydration Champions. This is from Jessie Matthew from Oak Lodge, Hollybank Care Home. We do regular 2 weekly nutrition meetings and constantly try and improve our dietary service to our residents in both our homes. So very useful tips. Thanks, Jessie. There's a question here which I think we'll ask Kirstine. Any tips on maintaining nutritional intake in patients with C. diff and dumping syndrome?
That's a hard one, Emma. I think again it depends on individual to go into that level of detail for those specific details. Usually it is small, frequent and often, and not having a very high sugary intake, because sometimes that can exacerbate the dumping syndrome. But perhaps one to discuss with your GP and your own dietitian.
Great, thank you. There's a question as well. Do you have any resources for encouraging better nutrition and hydration for stroke patients with swallowing difficulties and chronic fatigue? I think, Kirstine, if you could take that one again.
So again, speech and language therapy teams across Greater Manchester have come out with lots of resources which we can again share and signpost to, around the international descriptors of texture modification post-stroke. So we can certainly share those with you in signpost.
Brilliant, thanks, Kirstine. Tracy, again, she said, I have particular concerns about the health and well-being of care home residents who've missed the encouragement of family members to motivate them to eat, enjoy treats and even exercise. Will care homes get additional support as more non-essential visitors are allowed into homes? I think this is much needed. Don't know if anyone, I mean, I think that's a really useful contribution. Is there anybody who has any thoughts on that, about the support that care homes will get as more non-essential visitors will be allowed into the homes?
So I could probably say a little bit about that. So certainly from Oldham local authority point of view, we had emergency cabinet meeting and we announced significant resources to help with that extra catch up and extra financial resources which they are spending due to the COVID. And hopefully some of that should help with that. I think there's a wider point. Just I've read a couple of questions from participants around. My comments are not about why care homes are not feeding or not providing adequate nutrition to residents. My comments are why, as a society, this has not been our priority. And it should not be the job of a care home worker or staff only. It should be part of our job as a society, just to be very clear. And not that this is about a blind game of hospital versus care home versus community. If we really want to deal and resolve this issue, we need to, as a society, as individual, we need to take responsibility. And all of us should be responsible, not only the paid versus unpaid versus hospital versus care home sector.
Thank you. That's really helpful, and I think a really useful point. And I think certainly at the heart of the programme that we've been running is that this is something that we can only address if we all address it, if we're all supporting our relatives, our neighbours, but also in care settings, in hospitals. It's something that has to be addressed from all angles. Great. So there's a question about, I'm a volunteer with Re-Engage. Our guests look forward to our monthly tea parties, although they're on hold at the moment. I think that's something which lots of people are struggling with. We struggle to engage guests and volunteers, even though we know those socially isolated people are out there. It's heartbreaking. I think that's a comment, but yeah, I think, you know, the value of those kind of tea parties and those opportunities for people to come together is really significant. That's something that's come through very strongly in our research, and the more we can do to engage people who we know are likely to benefit from them, the better. But it's not always easy, is it? Some older people who have missed those social sessions where they ate and had fun with their friends may require support to build confidence to return, especially with scary headlines about a potential second wave. It's an important point. And then there was a question about the jelly drops. So some people may have come across jelly drops before. They're a really clever invention, and they've recently come to market now. So it's a way of supporting people to stay hydrated, which is particularly useful for people who may find it difficult to drink enough. So they look like sweets, and yeah, it's worth just researching. They're available for individuals to purchase. I think it costs about £4 for a tray of jelly drops, and they look like sweets. It feels like you're eating a tray of sweets, but actually it's really good hydration. Just trying to pull out more questions. So we have an ageing population in West Sussex. Would we be able to use the paperweight armbands? Have you incorporated the findings into dietitians' departments? Has it prevented admissions or increased referrals to the service? Kirstine, would you like to take that one?
Okay, so yeah, we would be more than happy for the model to be used in other areas of the country. I know we've got colleagues on the phone from Scotland, and I think they've certainly used some of our resources, and we have Wessex AHSN that's also been engaged in using paperweight armband within some of their work too. So there's no reason why we can't really roll these resources and programs out. We initially got engaged through all of this with the malnutrition task force. So certainly there were 5 national pilot areas, and that's what really gave us the kickstart within Salford, and then as we moved to scale up across GM. Yes, happy for dietetic departments to be engaged and involved in this work, specifically if you are working in primary care. We know obviously around malnutrition universal screening tool is obviously our validated, most widely used screening tool in the UK. But there is that place to think about how dietetics works alongside your public health and population health approaches. And that's where, you know, paperweight armband does have a place around how we can do a very brief intervention as to not to medicalise something that is potentially preventable malnutrition before we end up seeing this massive increase in referrals into primary care and therefore the knock-on into secondary care. So we haven't actually seen a big increase in community dietetic referrals as a consequence of either partnering with Age UK Salford or using the paperweight armband. So it doesn't actually put added pressure. If anything, it's important professionally. We don't work in silos as a dietetic profession. We need to be able to dovetail into primary care networks and other third sector partners within your areas. So please think about it and consider it.
Great, thank you. There's a message from Alex from the Vegetarian for Life organisation, and they're offering free live cookery demonstrations via Zoom and Facebook. We actually partnered with the Vegetarian for Life. Alex did a demo on our Facebook a few weeks ago, and it was really well received. It was a great session, quite informal, good way to just see different ideas about things that you can cook. So if you want to get in touch with Alex, his contact details are on here, and we'll circulate it as well with the other information that we're sharing. And then the final question is from Ursula Zahid from Berke. So she wanted to ask, are the day centres, etc., still working as stores for essentials? Can we get information on how we can access essential food items ordered and delivered to people who do not have anyone to help out? Now, I'm sure Carmel can help us with this from a Berke perspective, but I don't know if anyone else on the panel, maybe one of our councillors, can help us to think about this more broadly, about how people can find out about access to food for people who are, who need that access at the moment.
Yeah, as I've referred to in Oldham, obviously I can only speak for Oldham, but the hubs were set up very early on in the response to the pandemic and growing need of people to access food and other essentials. That has continued. There are places where food is stored. It is still being delivered on a regular basis, and many people have been supported by this. Not just older people, but all people who find it difficult to get out. But it is essential for so many of our older people. Details for accessing that are very widely published through various networks and groups and so forth. So that is something that I see continuing for a while.
Great, thank you. And Sam from Berke has said that we have community hubs in Berke, and she's given the number there. Okay, brilliant. Thank you so much, everybody. I'm sorry if we didn't manage to get to your question. We will try and respond to those questions, and we'll post them on our website as well as a follow-up to this webinar. So yeah, all that's left for us to do is to thank all our panellists and to thank everybody who's been part of the webinar today. We're sorry that we've overrun slightly. We hope that it's been worthwhile, and yeah, thank you very much everybody involved.
Thank you.